Hello, Holliston. Welcome again to another episode of Just Thinking. I'm John Cronin. Thank you for joining us. About a month ago, we had in leaders of our community who have a lot to say and do about your student safety. Dr. Kuska, Chief Matt Stone, and Chief Mike Cassidy joined me to have a conversation about what Holliston does from a holistic perspective to try and keep your kids safe at school. We talked at that time about the idea of overlapping units of government here in Holliston that help secure your students' safety. During that conversation, we talked a little bit more about the wraparound effect that these units of government do and how they play together. One area that we decided to separate and bring forward in a separate episode relates to Holliston Youth and Family Services. Today I'm bringing forward Jackie Weiner. Good evening, Jackie. Jackie's the Director of Holliston Youth and Family Services. When I was on the Board of Selectmen, I had the pleasure of working with Jackie and her team, learned an awful lot about the great services and work they do to keep our community safe. Jackie's role is a little different than the role that Superintendent Kuska, Chief Cassidy, and Chief Stone play, but yet it's integral. And I think this evening we want to dive a little bit deeper into kind of the services that they provide and how important they are to keep that holistic feeling and interoperability going to keep Holliston's kids safe. So thanks again for joining me. It's a pleasure to see you again. Wonderful. So one of the things that came up loud and clear after talking with our partners a month ago was that they all work collaboratively. Nothing's done in a silo. They're proud about that. Can you talk first a little bit about how you reach these three units and how Youth and Family Services takes the kids' safety sort of beyond the walls of a school, outside the school, and in some cases directly into their home?
Yeah, absolutely. First of all, I just want to acknowledge Superintendent Kuska, Chief Stone, Chief Cassidy. We have always worked incredibly collaboratively with each other. We talk the same talk, we walk the same walk, and we all work in tandem with each other to support kids in Holliston. The schools, I always say, are the heartbeat of our community, as well as our 55-plus community. I think we always think about our families and our older adults as the more vulnerable residents in our community. And so when it comes to safety, these social services, these different departments hold enormous responsibility in terms of making sure families have the resources that they need. When I think about safety, I think, how are we defining safety?
Right.
True, because safety for one family could mean physical safety, could mean for another kiddo, it could mean bullying, it could mean immigration, it could mean housing instability or food insecurity. So when we think about safety, it's such a broad term, such a wide term to define. As a mental health professional, I always think of preventative efforts to mitigate any harm that a child can experience in any of those domains. There's a landmark study that we all in healthcare look at, which is called Adverse Childhood Experiences. And basically what that study looked at were things that children experience early on in childhood can really impact them in the future. Things like early experience with substance use, or negative outcomes at home, or housing insecurity or food insecurity. Those things really have an impact on families. And I'm proud of the work we do in Holliston to support residents and our inner collaboration we have between different departments and resources here in town.
Phenomenal intro. At the back end of our talk, if you'd be so kind, we're going to circle back to the larger Youth and Family Services model that you have and all the other services that you offer. And thanks for touching on the older adults too. But generally speaking, when Dr. Kuska and Chiefs Stone and Cassidy were talking, that wraparound effect kind of brought into focus not just the school model, not just the public safety model, but the parent model. There's like a triumvirate of sectors that children need to live happy, healthy lives. Tell us a little bit more about how Youth and Family Services pulls from the parent connection between a student negative experience, to use your words, at school, and then the after school. How do you follow them? How do you help that kid bridge the stressors or the problems that they may be having?
I love that we're talking about this because it is so holistic, it is so wraparound, it is so everything I believe in when it comes to working with youth. Kids are often our identified clients, but it's really the family system that we're looking at. And we're really partnering with families. So when a family accesses services at Youth and Family Services, we're starting oftentimes with a screener. and we're meeting one-on-one with the family, and we're getting the history, and we're communicating with other team members that might be working with a child, or if they don't have a team behind them, we're building that team behind them. So we're thinking about communicating with the pediatrician, we're thinking about communicating with the school guidance counselor, or public safety, or anybody that's working with a kiddo.
Help me real quick, the referral process.
Yeah.
How does Youth and Family Services gain a client?
Yeah, great question, in multiple different ways. Our schools, our primary, our referral.
Referral through schools, sure.
Pipeline, right? Any school counselor knows how to reach us, access us. I love when I see our little tagline in a school's signature, you know, who to reach in case you're in need of support. We also receive self-referrals, so families can call us. And usually whom they're going to speak to first is our service navigator, Allegra Dennehy, who is like our little mascot at Youth and Family Services. And she's the friendliest, warmest face that somebody can first come into contact with. And Allegra is going to put that family on our tracker. And then that signals for my clinical coordinator, Kirsten, to reach out to the family. So we're making an immediate response once we get a call. And once Kirsten reaches out to a family, we're inviting them in for a screener. And then from that screener, we're helping them either access services within our department or elsewhere.
So that's perfect. So the parent, someone in cases where there's a minor here, they're feeling like they need additional services beyond school. So that could come to you via the school counselor officer or office and or the family. Is there any cost?
No cost whatsoever to Holliston residents.
So in the event that the family engages and there's some need for continuation of services, say they didn't come from the schools and the student child, if you will, the minor, is engaging with Youth and Family Services. Is there a connection where that client is referred? Are you informing the schools, hey, we're working with this individual on these matters. You may not be aware of it, but this individual has some needs that we'd like to see continued into the school experience. So I'm trying to figure out, how does that circle complete itself?
That is
if it comes through that door.
Yeah, that is our unique and really special part about becoming a client of ours at Youth and Family Services. We will walk hand in hand with a family through anything that they're experiencing. So we're not just meeting one-on-one with our kiddo, but if they want us to, we're going to school meetings with them. We're reaching out to school counselors with them. We're connecting with the softball coach. We're connecting them to other resources in the community. We don't just think about kids and what problems they have. We're thinking about what's contributing to those problems and really trying to work with the whole family and the whole team around that child. And that's for some families that want that. Other families, they just want to come in and they want to feel some support as a family unit, and they may not need that. But one thing we're really good at is building that team around a kiddo and working with all the different providers.
Scope-wise, Jackie, how many families or clients broadly are you tracking right now to give folks an idea of what's the workload look like?
Annually, we make contact in our office-based program, in our clinic-based program, with about 100 families a year. If we're not working with families one-on-one, we're providing service navigation, and we see about an additional 50 to 75 people in service navigation. And then if we're not working in clinic or in service navigation, we're supporting about 20 residents annually through our Community Action Fund.
Great. Real quick, on the school piece, we talked a little bit about Holliston High School's partnership, as well as obviously public safety. What about kids who don't go to Holliston public schools? They may be homeschooled, or they could very well be going to private schools or outplaced. Same system, same process?
Same system. If you live, work, or go to school in Holliston, we're not going to turn you away. We oftentimes prioritize kids that live in Holliston. So if they're school choiced in Holliston but live elsewhere, we're not going to turn you away, but we may not be able to take you on. So we might refer you to other resources in that child's community. But live, work, or go to school in Holliston, we're just a phone call away.
I can imagine when a family, a parent engages Youth and Family Services, you know, they're looking for help, right? Things that are happening at home, happening with the child, they're not thriving, there's something going on, they've run out of their own answers. How can Holliston's Youth and Family Services reach the parent and ultimately the child or the client to bring trust and empowerment forward? Because I think that's so important what you do, right?
Absolutely. Trust is the cornerstone of successful counseling, of successful social services and resources, and just human to human, right? People need to feel that trust, that they're accessing services that are going to take the best outcome for their family and give them the best resources. We have the best families that we work with at Youth and Family Services. They're just incredible, engaged, wonderful, wonderful people, and we pride ourselves on that trust and communication and collaboration.
And despite it being a public system, a taxpayer-funded department, I'm guessing you can affirm and guarantee confidentiality.
Confidentiality is at the corner of everything we do, whether it is in our office, when we're out in the community, in meetings. We take every family into our care. We treat them like we would treat our own family members, and we would never share information that was not privileged to be shared. And that goes with any client, any situation, even outside of a counseling relationship.
So now that we've kind of defined how people enter the youth and family services world and how it connects with the schools, public safety and so forth, let's go into a little bit of those two models, the schools and then the public safety piece. So a couple of examples. So if we're now looking at a child who has some learning difficulties in the, say, the elementary level, and a parent is concerned because they haven't seen the child advancing academically, they're not sure what's happening, but the child's become a little bit more non-communicative. They have some questions. They may not be willing to, at this point, jump in and say, I want to bring my child in for an evaluation. Can they simply call and get some questions answered?
Yeah.
Starting with, let's call it an icebreaker call.
Yep.
Okay. So tell me a little bit about what that sounds like. Who is that person going to speak to? Are they licensed?
Yep.
And what kind of dialogue does that entail?
We're all licensed in our office, including our service navigator. We all have a license to practice social work. And I also have a licensed mental health counselor on staff, and we're all trained in how to talk with families, assess families, communicate with families if there's a level of risk. We're trained in how to, communicate and find out information to understand that level of risk. And for a family that calls in that certain example, there is nothing more concerning or difficult for a family when they pick up that call. It is so hard sometimes for families to reach out. Sometimes families don't even know what they're asking for, what they're looking for. And that's why they're met with usually me or Allegra answering that initial call. And we're just walking them through the services, walking them through kind of what the school team might be saying to them or the pediatrician might be communicating. And very quickly families feel like that partnership is there with them.
Right. So once that assessment's done, the triage, if you will, the parent has an option. They have a choice at this point to move further in, get additional services, perhaps a one-on-one. We're still in that confidentiality space. What if part of that dialogue is in conflict with what they think is happening at school? So let me breathe the example a little bit, breathe life into a little bit more. They feel as though the child might be a victim of bullying or some isolation or something that is happening in the schools that they feel inadequately supported for. Not unheard of. So the child now presents, and Youth and Family Services has now what appears to be a report. Does any of that data circle back to the schools based on this confidentiality entry? How does that dialogue work?
Yeah, it's a good question, right? Like if a family member calls me or if a parent calls me, they're concerned, or sometimes we see things on social media, right? And people are commenting, call Youth and Family Services, call Youth and Family Services. So what happens when you call Youth and Family Services is a great question. If there's an immediate safety concern, confidentiality in that regard, unfortunately, can apply, right? If I think a child is being harmed or another child is being harmed, that has to get communicated, and we're very sensitive to that when we talk to family. If that ever comes down to what needs to happen, families know we're explaining that process up front to them, that we're mandated reporters. Yes, there's confidentiality, but there's limits to confidentiality. Having said that, 99% of the time, it's just a conversation between a parent and a provider,
Right.
and walking them through how to communicate that to the school, so that the parent feels more empowered to take that step and to communicate.
I see.
And feel more confident in what they're saying.
So the therapist or the staff at Youth, they're not taking that step. They're not calling the teacher or the counselor in the school directly. You're giving the parent or the student, in this case, the directions. This is what you need to look at.
Our goal is always to equip parents to feel successful, and to not rely on us to do that for them, but to give them the skills and the tools they need to be successful with communicating with the school.
I'm using terms that I'm not licensed to use, whether it's minor or whatever. Let me ask you a question. Can a student under the age of 18 call you directly?
Yeah, absolutely.
And talk a little bit about, like, how does a student, absent parental support, gain access to services?
So this is a tricky one, right? Because in the state of Massachusetts, there are laws, right, that a child cannot consent to services if they are under 18 or really it's legally under the age of 17. Okay. And so that doesn't mean that kids don't find us and call us and try to talk to us. When that happens, we're really working with the school's support team to really help that child navigate services and navigate that tricky family dynamic. We are more than willing to make any accommodation for any child, whether that means meeting with them at the school, meeting with them at a confidential place outside of our office, as long as we're not going behind a parent's back. So that does happen. It is tough sometimes to tell that child that hard line, but that doesn't mean we're leaving them with no support. But we will do anything possible to maneuver around what we can and go around the mulberry bush as much as we can, even if that means just a parent calling and saying, you have my consent, right, and documenting that. We can still move forward. We're not sticklers for every step of the way, because we know there are unique circumstances under that, but if a child is under the age of 17, we do need to inform the parents.
Dr. Kusker, if I recall correctly, brought forth an example, Jackie, that I think speaks a little bit to this space, and it's probably more a sign of the times. She talked a little bit about when and if I became aware that there was some online issues, and I mean social media matters that involve a student's safety. I don't wait to ask too many questions. We get involved almost immediately. We intercede. We try to learn as much as we can. And that's when she said she's talking with the school support officer and obviously technology folks to learn a little bit more about what's going on here, so that it doesn't become a larger issue. You mentioned social media. You talk first a little bit about what is social media doing these days to help keep kids safe, and do you feel it's adequate? What's your opinion in this space? I'm going to ask you a tougher question after that.
Yeah.
Talk a little bit, because I think a lot of parents feel like that's the behind the curtain world that they dread for their kids. Too many of them not ready for it.
Listen, it is a really loaded question. I'll be honest with you, I happen to love social media. I happen to love everything that the internet can provide us, right? At my fingertips, I can look at the news, current events, everything that's happening, right? I think we all agree that there's a lot of good sometimes that can come from social media. Yeah. There's also a lot of bad that can come from social media, especially when kids are exposed to things beyond their ability to understand. Those quick 5-second reels, those quick videos, right? We are exposed to these things in a way that can really alter sometimes our brain chemistry and our ability to process information. And social media can be great when, when it is observed by a parent and monitored by a parent and structured in such a way. We used to have these discussions all the time with parents, like how much is too much screen time? How much is too little screen time?
When should I get my kid a phone?
When should I get my kid a phone? We've really moved away from how many hours a child should consume on social media, and we're more now in the space of, sometimes kids use social media to build a hobby, right? Like I have a kiddo who loves 3D printing, right? They might spend 2 or 3 hours on YouTube researching how to use their 3D printer, and then they're going out and they're applying how to use their 3D printer. Excellent use of social media. But when social media takes a real dark turn is when kids are led into social media in a way, or group think in a way through social media, through text messages and large group chats and Snapchat and all the apps that are out there in a way that they're not equipped to handle.
Right.
And that's when we start to see bullying. And that's when we start to see good kids who mean well get sucked into this vessel of unstructured, unsupervised communication, large-scale communication, and it leaves everybody vulnerable.
Broadly speaking, would you say that type of issue is very prominent in a lot of the clients you see through the schools?
I think all kids are touched by social media in some way and exposed to comparisons on social media of their peers. You know, we have influencers, if you will, that kids are exposed to and idolize. And so I always talk to parents about having that conversation with kids and having it early on,
Right.
as early as you can, about what they're seeing and what they're exposed to, and really take kind of stock of the quantity of what they're watching. Because sometimes, for one kid in a family, you may not worry as much about their use of technology, but for another kiddo, you might say, I'm going to have a little bit more restriction on my kiddo in that way, because I know them and I know what they're capable of. And so I hate blanket statements. No kid should have a phone before X age, or nobody should be doing this. I think it really is case by case and on an individualized level. But parents shouldn't be so scared also. I think there's this fear out there that if I give my kid and this could happen and that could, and I get it, it's very real. But social media can also do a lot of great stuff too.
Right. Should social media be outlawed for children under 16?
For my child, I might say yes, because I know that their consumption can be a little bit more difficult.
We
But
laugh because some of us can imagine a time when that was the case. It wasn't outlawed, but it wasn't there.
Right,
And
right.
so the reaction sometimes is an overreaction in some cases, but you
Right.
got to wonder what would be the quality of life for 16-year-olds if that were the case, and
Right,
could they
right.
have the chance for the maturity to come around,
Absolutely.
and for the experiences of life to help them understand what they're looking at? Because as you
Absolutely.
said, and I agree with you completely, the use of technology has dramatically and positively improved many adult lives across the
Yeah,
board, and
yeah.
it's not going away.
Right,
But
right.
for vulnerable youth especially, it's become, and I don't think it's going to change, a major impediment to the healthy growth of some kids who aren't ready for it.
Absolutely.
Let's move a little bit into the public safety space. We talked a lot about how the schools and the school apparatus is there to carry kids or follow kids outside the school day. Public safety. One of the things I was struck by, especially with Chief Cassidy, is sort of the nature of how Holliston uniquely follows kids from all four corners. Mike sees them in the schools. He's there quite frequently. He's got a school resource officer. Their job is to become very familiar and friendly with every child. That doesn't always work well for some kids who find themselves in a negative impact with school and law enforcement. So again, let's go back to the child that enters your space who is not so much of a school issue, but more of a public safety issue. They're now in a different space. Can we agree that that's a little bit more serious? You're working with who? You're working with the family and what outside units? So you're working with police, school resource officer? Tell us a little bit about the client who comes into the space who has more of a public safety wraparound.
Right. Yeah. No. That you're right. It is a more serious situation, and sometimes kids make silly mistakes, right? And that's not to say that adolescence isn't about healthy exploration and going down different avenues that maybe we wouldn't like to see them go down. But when I think about adverse childhood experiences, kids that are interacting with the law enforcement, we want to have a really swift involvement with that kiddo and really mitigate against any further negative outcomes that could come from it. So we work very collaboratively with actually the Middlesex DA's office and in collaboration with our public safety friends. And we have a restorative justice program called Court Diversion. and it's been around longer than me. It's really the cornerstone of our department. It really paved the way for me, actually, when I came on board as the director, because there were these rich partnerships that existed before I even stepped foot in my department. And so the longevity of these relationships have transcended over time for these kids. And so we have a diversion program through our DA's office that kids can get referred to, which essentially takes them out of the court process, takes them out of juvenile justice proceedings, and really works on restorative justice. So the harm that's been done, repairing the harm. We do weekly sessions with them.
So just real briefly, so a child or a minor is now been designated through the restorative justice diversion program. They come to you, virtually or in person. Are Holliston PD in the room, or are they removed and their job is done and your job is now to help the child find a healthier path towards decision making and so forth? Who's in the room, and how does that public safety piece connect to you?
The only time we're all in the room together is during our initial conference, which is more of like a round table. It's really more of a way for us all as family and providers in this kiddo's life to come together to talk about support services and resources for our family. Then from there, we don't even focus on the law enforcement side or the decisions that have been made. That's been done. What we're focusing on with that child is developing their confidence, developing their skills, so that they feel like they can go back out into the community and make different choices. And so we have a really wonderful program. Kirsten actually is my court diversion coordinator, and she does such a lovely job with these kiddos. We get them connected to sometimes town hall. They'll be doing filing for different departments at town hall. We'll have them working out in the community and doing some volunteer work.
I'm afraid I don't know the answer to this question, but if I recall correctly, Chief Cassidy talked about a resource of advocates. It is a separate social work contract that they use to help people in distress. So it may not necessarily be students or safety, which we're focusing on, but is that a part of the diversion where the advocate or the social worker working with the individual or the families connect also?
Sometimes they can overlap. Advocates is our local psychiatric emergency services. Every we call it PES program, has a catchment area. Advocates happens to be our local resource, as well as Leanne from the police department. She's our social worker. She's shared by 2 towns. And we all collaborate together and work together. If a child is in crisis, we'd love them not to have to go sit in an emergency room and get stuck there. We'd love for the PES team or Leanne to go out and meet with the family in their home or in a community setting to see what's going on with that kiddo and see if we can avoid higher level of care.
A long time ago, I was taught that ships usually don't go down in smooth seas on sunny days. So I'm going to imagine for a minute that a lot of these crises don't happen between 9 and 5. Talk a little bit about your availability for these kind of emergencies when they occur that may need Youth and Family Services help.
Yeah, I have been known to give my cell number, in emergency situations. I think about fires we have in the community or real urgent, devastating tragedies that happen, loss of a parent, things that I've unfortunately had to support families and walk families through. People know how to reach me, and they do.
Back to that student, if a family's enduring a student or a young person's breakdown of some kind. It's 10 o'clock at night. The first reaction is probably to call 911. The police respond. At what point does Youth and Family Services loop in to help that student and the family? Yeah,
all officers are trained in how to counsel a family in the aftermath of something like that. So all officers know how to reach us. They know how to give that information, how to counsel that family on how to reach us. Oftentimes they're reaching out before the family does to let us know. They also...
Well, that's the link I wanted to explore. So if that event occurred, it's a Tuesday, so Wednesday you come to work and you're aware that Holliston PD had an interaction with a family on this matter. You're just getting the brick and mortar of the response, basically, but that's not the referral. Does the parent or the client have to come see you then? They have to take that step, don't they?
We like that step.
How does that work?
We like that step to happen, but sometimes that step is really overwhelming in the midst of a crisis or a stressful event.
Would you make a call?
We would, or we would encourage the police officer or the social worker to help that family make that call together.
Okay. Yep.
But however they come, whether it's directly to us or via a number that somebody's passing along to us, we will make that call.
Got it.
Yeah.
You know, Jackie, it's a pleasure meeting with you and catching up on all the great work that you and your staff do. We've covered the role of parents, schools, public safety. When I started this evening, I said I'd really like you to finish up by informing folks what else does Youth and Family Services do beyond the student safety measure, because you're a wealth of resources. It is taxpayer funded. It's right here on Washington Street. Talk a little bit about some of the other great work that you folks are doing for our community.
Yes. So under Youth and Family Services, we have a wonderful coalition called the Holliston Drug and Alcohol Awareness Coalition. We are on our third year of a Center for Disease Control grant called the Drug Free Communities Grant. And we're doing incredible work in terms of prevention in the community, uplifting educational opportunities for families, supporting kids through wonderful leadership opportunities with Zoe. Zoe's getting ready to take a bunch of kids to DC in a couple weeks for her leadership program. We also have access to the Community Action Fund, which is our financial relief program for families in need. And so anybody in the community, any Holliston resident can access our Community Action Fund. We do things like utility bills. We do things like car insurance payments, anything of the like.
Yeah, I remember when I was on the select board during the pandemic, we were trying to funnel some ARPA money into the program to help people in need as well. And you also have a board.
I also have a board. The board actually...
Some of the best people I know about.
Incredible, incredible. My youth advisory board, they actually, history of the department, the advisory board existed before the department. They have been an instrumental component of our success here in town. So we have a wonderful 7 committee volunteer members on our youth advisory board. We meet monthly. We are actually looking for, we have an open vacancy. We're looking for a clinician to join our youth advisory board. So if anybody out in the community has an interest there, please reach out.
We'll ask our HCAT folks to splice in some contact information after the show so they can reach you. As we wrap up, I just wanted to sort of bring this full circle. As we met with the chiefs and the school superintendent in November, and now with you, Jackie, citizens and residents who are watching should feel comforted that their school student experience should be a little bit more restful in their thinking. We have support. There are these wonderful services that wrap around, that's the word that I'll use, to follow the child through the school experience, the after-school experience, and then through their school career. And in some cases, I would imagine you'll follow some of those clients after they leave the schools until they find their next destination. Families should never feel alone. They should always feel like there's a place to go, somebody to call. I'm so grateful to have you in tonight because I think you're another of the important prongs in Holliston that should make families feel very safe, or at least assured that there is help out there, especially during the holiday season. So I want to thank you so much for coming in. Pleasure to have you. Folks, thanks for joining us during this second and follow-up conversation on school student safety. We hope you listen quietly and intently on how important it is to keep everyone safe, and wishing you the very best during the holiday season. Thank you for joining us. Good night.